Call the Senate Appropriations Committee to order. I think before us today we've got health. So whenever you guys are ready, come on forward.
Good morning. Chairman Huff, thanks for allowing us to be here. Just a couple of brief remarks. Everything that you hear today is about overarching two pieces of information. One, we have an aging population, not a surprise to anybody, but by 2030, we'll have more of a population over the age of 65 than under. And second is that we believe that our public health system needs to modernize. We've talked with you about this individually. I talked with you about this last time. Not in this particular budget, but by next year we anticipate that we'll bring forward to you thoughts about what modernization looks like. Right now, about 50% of our local public health agencies will tell you they cannot do the basic core elements of providing public health because of capacity and resource issues. And we believe people aren't safe until everybody has that capacity within their local area. And so we anticipate bringing that forward to you next year. So with that, I will turn it to Marcy Mahaney to begin our presentation.
Good morning. Marcy Mahaney, Director of Division of Administration for the department. We have provided some handouts for you. I'm not sure if you all have those. So I wanted to talk about that just a little bit. You will hear from each of our division directors about their new decision request. We do have 30 new decision requests in our budget this year, totaling $93.6 million. DHSS does perform a large variety of programs and services. If you look at page 4 of the handout, there are graphs there that show our total budget, and our total budget request is for $2.8 billion. The first graph shows a breakdown. We are 73% federally funded. And then the second graph shows the general revenue amounts, and you will see that our Medicaid home and community-based services program accounts for 80% of that general revenue. I will mention much of the 20% remaining general revenue is match on our federal funds. And so just a little bit about the breakdown there of our budget. We do have 168 active federal grants and 3,648 active contracts. We do a lot of pass-through services with subrecipient, our community partners that we work with. So I wanted to also mention an item that you will see denoted in some of our core reallocations throughout the book. I just wanted to mention it since it's pretty predominant through there. The note will say reallocation due to the new movers financial system. You all are aware that we're working on getting to a new financial accounting system. Very excited about that. Instructions were received from that team to have one budget number, so we call it a 5C number, for each core item. And so some adjustments had to be made to accommodate this request, and so it's an accounting function, but I did want to mention it since you will see that in many places. It doesn't signify any change in fund usage or programmatic intent. It was just kind of a cleanup to get us ready for that mover system. That's a very high look at our budget, and so we'll be sharing more information as we progress today. I did want to ask how the cadence of how you wanted to go. Do you want to hit every core, just
the quicker the better.
Okay. Do you want us to hit every core item? Yes. Okay. Well, with that, if we could turn to page 8, I'll walk you through the statewide. This is our FMAP adjustment. The first item, it's just a GR adjustment, and each year the appropriations must be adjusted for changes in the federal medical assistance percentage rate. The state share increased this year, and so this is the corresponding $8.4 million GR increase for that state share requirement. I'm sure you'll see that from all the Medicaid agencies. The next one on page 12 is department-wide. The governor's recommending a 3.2% statewide pay plan for all state employees. We're very excited about this, $4.1 million for our department for that. Our turnover rates are getting better. In 2022, our turnover rate was 24.8. 2023, we were down to 16.3, and so we're very pleased about considering this increase. Next on page 52 is our director's office, and the director's office does serve as the focal point for leadership and coordination across the department. This request is for 11 FTE and $980,000 for our director, deputy director, Office of Public Information, and Office of Legislative Affairs. Next on page 61 is our Division of Administration, and our division provides administrative and financial support for the entire department. So we do the budget submissions, review and process contracts, do grant applications, pay invoices, take care of payroll, those types of things in our Division of Administration. This request is for 81.85 FTE and $8.9 million in total. This 8.9 does include around $2 million of our department operations, so things like fleet, leasing, those types of things are in here. Health Initiatives funds on page 83. This is a transfer appropriation. It deposits funds into the Health Access Incentive Fund for the Office of Rural Health and Primary Care, and these funds are spent each year. This is just the transfer side, but there is a corresponding appropriation in the Division of Community and Public Health's budget. And these are contracts to increase interest in medical professions for rural and underserved areas. Next is page 88, debt escrow. Sometimes students who take loans, we do have the medical loan program, towards those medical degrees do not fulfill their obligations to the department, and so this authority is needed so that we can receive tax refund intercepts from the Department of Revenue. Next on page 93 is our refund appropriations. This is for $50,000 in general revenue, $100,000 in federal, and $251,200 in other. We do sometimes have to refund money back to folks who overpay us, and these are things like vital records, excuse me, license application fees, sewage disposals, construction fees, sometimes training or registration fees. We don't always know what funds we need these in, so these are estimates. And so last year we did issue $94,429 in refunds. Page 97, you will see a flex request that goes along with this refund. We are requesting 50% flex between federal and other funds, and this is due to the fact that we don't know who's going to overpay, so we don't know what funds to anticipate. Last year, we did use this flex for $1,789, so not a huge impact, but it's kind of important for us to maintain that. Next is on page 99, our federal grants. This is a $3.1 million appropriation, and this is for us to use in between budget cycles whenever we get new grants that come in or need additional, get some sort of additional authority in the federal grant that we need appropriation for. And the same situation on page 104 for donated funds. We sometimes receive donations from private entities, and this allows us to use those funds in between budget cycles when we would do a new decision item for that. And lastly is on page 109 is our medical preceptorship transfer, and this is $200,000 in other funds. It's a transfer appropriation for a new tax credit, which began last year, and this is for qualifying community-based faculty physicians who volunteer to mentor medical students. This is $1,000 for each preceptorship for a max of $3,000. And this is just the transfer appropriation that goes with that program. If no questions on the Director's Office and Admin, I'll turn it over to our Division of Community and Public Health. Okay, thank you.
Good morning. I'm Lori Brennicke, and I'm the Division Director for Community and Public Health. And just want to quickly give you a little overview of the division. We are over 100 diverse programs. We're currently funded 95% with federal funds, 4% general revenue, and 1% other. We have around 570 FTE, and during last fiscal year, we managed 151 grants and 2,908 contracts. So we're very much into the grant side of operations for the department. So our services span birth to death, all with a common goal of improving health through prevention and response. And as we move through the budget book, I'll just describe a little bit more of the activities under each one of the cores. But before we begin, I want to tell you about some reallocation that our division did for the budget book this past year. So through last several sessions and various conversations, House, Senate, folks felt that the way our budget book had become to be structured, that it was not very clear about the diversity of the work that we do in the division, because we have many programs rolled up into just some common like operating course. And so on this handout that was provided to you this morning, we just wanted to show you that prior to this session, we had 10 cores, and after reallocating our budget book to align with how we actually operate, we now have 17 cores. So hopefully you will find that, it just gives you a little bit more detail about the work that we do. There are 2 trade-offs to this, and we discussed all those things with budget and planning and the House and Senate analysts before we went through with this. But one is that because of this reprogramming, we will not be able to see our actual expenditures until fiscal year 25. And the other thing is that we are requesting transitional flex then in each one of our budget sections, because while we spent a lot of time this summer, it was over 8,000 lines of coding into the BRAS system, and there could just be a potential that our estimations of what we thought based on previous year's spending are not exactly what the appropriations need to be. So we do anticipate that as we go through next couple of years, that transitional flex should decrease, because we will become more into our normal operating rhythm. So to the left of me is Maddie Starnes, our fiscal manager, so I may refer to her if there's any questions regarding that part. So with that, any questions? Are we ready to move? Okay, all right. So on page 113, we have the core for Community and Public Health Administration. Governor's recommendation is for $5.3 million and 68.4 FTE. Assume if you want any extra details, you all will just stop me. Is that? Go on to page 248. Or actually, before we do that, would you like to know about where we made core reductions on pages, or also would you like for us to
Only
go
if
through?
the committee has questions. Nope, we're good.
Okay, all right. And then I will assume that we'll skip our flex forms unless you, okay, all right. Okay, so then on page 248, this is our core for our activities in cancer and chronic disease control and prevention. The governor's recommendation there is for a total of $9.37 million and 20.51 FTE. You will note that the difference between what the department recommended and the governor recommended is a decrease of $666,077 difference in GR, but that was actually at the department's request. We figured out between the time of our request to the governor's request that we had inappropriately aligned one of our grants into the wrong section. So if you go on to page 267, this is our new decision item for Alzheimer's appropriation. Governor's recommendation for $388,000 and 0 FTE. We have received our first prevention grant in the area of Alzheimer's. So this allows us, the federal authority, to bring that grant down and do public health education around the importance of screening and brain health for preventing Alzheimer's. Go on to our page 273. That's our core for communicable disease control and prevention. This governor's recommendation is for $8,040,000 and 40.56 FTE. This is the section where you notice an increase of the $666,000 due to the adjustment I talked about in the last core. On page 287 is our core for community health and wellness initiatives. The governor's recommendation there is for $13.46 million and 21.16 FTE. On to page 302 is a new decision item in this core for a governor's recommendation of $216,300 for the purchase of fentanyl test strips that we will distribute to our local public health agency partners and our STI clinics that we work with. Fentanyl test strips are a harm reduction tool. Up until last session, they were considered drug paraphernalia and not able to be used in Missouri for harm reduction. But studies show that they are a very effective tool. A study from North Carolina showed that 81% of those with access to fentanyl test strips actually tested their drugs before use. and if positive for fentanyl, were 5 times more likely to change their behavior in order to reduce the risk of overdose. All right. You go into page 306. This is a new decision item for cannabis education. The governor's recommendation is for $2.5 million from other fund. That other fund is the Veterans Health and Community Reinvestment Fund. The funding for this request would be used to coordinate an educational campaign for residents and tourists about the safe, legal, and responsible use of recreational cannabis. You go on to page 311. This is our core for emergency preparedness and response. The governor's recommendation is a total of $15.3 million and 36.76 FTE. And in this section is a new decision item on page 330. This new decision item is the governor's recommendation of $505,130 from the other fund. The other fund is the Federal Reimbursement Allowance Fund. What this new decision item is for is to allow us to do preventative maintenance on the ventilators and the powered air purifier respirators that our department has in stock and ready to be deployed for our hospitals and our EMS agencies. Typically, we have this amount due to a novel virus or pandemic, so we acquired these during COVID with COVID funds, but we no longer have the COVID funds to support the maintenance ongoing. So if we want to keep these in stock and available, then we need this money to sustain that maintenance. I will say that these things are not just used in emergencies. Like, for instance, we recently had some deployed to a hospital whose whole entire supply of ventilators were recalled by their manufacturer. So then we loan these out to allow them to utilize these. So they can be utilized, you know, for various situations to keep the hospitals and the EMS in operating under emergency conditions. All right. Any questions? Okay. On to page 334. This is the core for environmental public health services. The governor's recommendation there is for $7.1 million and 74.41 FTE. On to page 351 is a new decision item in this core for our Legionella program, our cost to continue. The governor's recommendation is $318,164 from general revenue and 1 FTE. So the department stood up a very robust Legionella program about 2019 when Legionella cases in Missouri and U.S. Kind of started to heavily increase. The importance of this program is that an individual with Legionnaires, especially if you are in a nursing home or in immunocompromised, the rate of mortality is about 1 in 4. So when we have a report of Legionella in a case of an individual who is a resident of a healthcare facility or could have stayed at a lodging facility during the time of incubation, our environmental staff actually go out to those facilities, look at water treatment plans, do testing in the water systems and those things to test for the bacteria, and then when those are found positive, recommend follow-up testing, treatment plans, and follow along with them to help them overcome that situation. The reason this is a cost to continue is because when we stood the robust program, we were able to tap into some PHHS federal funds. It's a public health block grant fund. That block grant has changed its scope, and this program no longer fits under that scope, so they have told us that after this year, we'd have to look for other funds to continue this. So this is for the reason for that new decision item request. Page 357 is a new decision item also for environmental health. It is governor's recommendation of federal funds of $1,112,860. It is to allow us to accept additional funds for about 7 grants that section already receives, federal grants. So this just gives us the appropriation authority to accept those funds and continue our work. Page 364 is a new decision item. Governor's recommendation for $833,333. This is for a new grant that we hope to receive from HUD. It is a lead hazard reduction grant. it will allow us to build the capacity and infrastructure so that we have contractors available for remediation of lead in residents, and especially in residencies where we have children under the age of 6. So after this grant, and if we're successful in building that capacity, we hope to bring down further grants from HUD, which would actually allow us to pay for the remediation in these homes that need that lead removed. All right, I think you need to move to Budget Book 2.
Real quick,
You do?
Lori, on the
Yeah.
lead remediation, is that something that the department has had calls from concerned parents about recently? And the only reason I bring that up is that very recently, actually, our school district down in Springfield released lead testing results, and I think there has been a more of a concern by parents, obviously, after some of that information comes out, and a lot of it's just education. But I'm just wondering if have you seen the same thing?
So what happens for us is that we get blood lead results, and when they're above a certain level, then we go in and case investigate. They send actually our lead investigators out to the environment, the homes. A lot of times they identify homes that have this, and then a lot of times these folks are maybe renting or and don't have the money to remediate, and so that's where we get probably the most concerns. Sometimes, you might, but a lot of people don't recognize lead in their environment so much. They don't realize it's in their paint or in their window infrastructure or in their pipes. So, yeah. Okay, let's see. I think I'm on page 368. Thanks. This is our core for genetics and newborn health services. Our governor's recommendation there is for $4.7 million and 19.2 FTE. On to page 383, that is our core for health informatics and epidemiology. Our governor's recommendation there is for a total of $5.8 million and 55.16 FTE. On to page 395, that's our core decision for HIV, STI, and hepatitis services. The governor's recommendation here is for a total of $109,049,192 and 47.5 FTE. On page 411, you'll see a new decision item. The department's request was for $252,647 in general revenue and 3 FTE to increase our disease intervention specialist positions due to the rise in STI cases in Missouri. This new decision item was not recommended by the governor.
Senator Arthur.
Thank you. Do you have a sense why that wasn't recommended?
Do not have any feedback from that.
Okay, thank you.
On to page 416. This is a new decision item for hepatitis C virus testing support services. So this NDI, the governor's recommendation is for $315,827 and 1 FTE and from the other fund. The other fund is our opioid treatment and recovery. So what this will do will allow our state public health laboratory to stand up confirmatory testing for hepatitis C. So when we are out in the field and give away like rapid tests and things, those are just a indicator but need to be followed up with a confirmatory test. And for our individuals that are underinsured or uninsured, they don't have those means, so this would allow us to be able, our providers, to send to the state public health laboratory so they can do the confirmatory testing. And the reason why this is so important is because hepatitis C is a very costly and diagnosis and something that no one wants to live through. And so we now have treatment that is very doable, affordable, tolerable, and so we can eradicate it, and so we're not spreading it to others, and that health conditions don't increase to the point that someone needs a liver transplant. So this little bit of funding allows us to do the confirmatory test and to continue to combat hepatitis C from our population. On to page 423, this is kind of a new decision item somewhat related to that. This is the governor's recommendation of $288,750 and it is for rapid tests. We have some grant funds, very limited from CDC for Hep C, so it allows us some purchase of these, but we need more to be able to distribute through our partners. Right, if you go on to page 427, this is a core decision item for our local public health agency support. The governor's recommendation there is for a total of $19,924,106 and 3.84 FTE. On to page 439, this is our core nutrition services. This is our 4 USDA programs that we operate on behalf of FDA. The governor's recommendation here is for a total of $214,139,498 and 57.53 FTE. On page 454, you'll see a new decision item related to this core. We have had a growth in the enrollment of providers in both our child and adult care food programs and our summer feeding program. Our nutrition specialists who work for those programs are the ones who go out and provide training to our new providers. They do the technical assistance, and they also monitor all of our providers to ensure program continuity and integrity according to the federal FDA or USDA regulations. Because of the increase of providers, we need to increase that staff in order to accommodate that increased provider enrollment. So the governor's recommendation here is for federal appropriation authority in the amount of $181,288 to support those two new positions we were asking for.
But I don't see any FTE associated with that line on the governor's recommendation.
That is
so you got the
correct.
money but no people.
Yes.
So how does that work?
So what that means for us is that as a department, we have X amount of FTE. If we have the PS, we can spend it, but we have to really strategize then what's our priorities for FTE positions. We look sometimes for vacancies or
So are you
efficiencies.
going to shift 2 FTE over to these roles or not?
What's that?
Are you going to shift 2 FTE over to this role?
We really need to, so that would be a decision we
So
have
that's
to
a
make.
yes?
Yes.
Fantastic. All right.
Page 459 is our core for rural health and primary care. This decision item is for a governor's recommendation in the total of $8,510,718 and 6.06 FTE. You will notice here that on the other category, in the governor's recommendation, the FTE recommended and the other dollars in PS was reduced by 2 FTE. And that is because I will explain why when we move to our new decision item on page 476. So last year during session, we passed a bill to create the Health Professional Loan Repayment Program. And with that program, we are giving loan repayments to healthcare, mental health, and public health professionals. In that legislation, we also moved back the nursing scholarship and loan repayment program to the Board of Nursing. So meaning that the fees that were coming from the Board of Nursing to health for that program and was funding the 2 positions that we utilized to run that program was coming from our nursing fees. Well, since that legislation changed, we no longer receive those fees, but we still have the same programmatic work to be accomplished. So we're not increasing 2 FTE, we're just fund swapping them from the other fund to general revenue. And so that's why you see the new decision item here, the governor's recommendation of $116,000 and 2 FTE. All right, on page 4.
Lori, real
Yeah.
quick, I'm going to go present a bill next door. So the very capable senior citizen,
Okay.
Senator Sirafoy,
I
will
will-
be
I will
will be
interrupt about as often as
entertaining
Chairman
the
did.
committee.
Okay.
Go ahead, proceed.
All right, thank you. Okay, so we'll move on to page 480. This is our new decision item for the Health Professional Loan Repayment Program. The department request was for $3,090,000. That would allow us to expand that program. Right now, we have about $970,000 for loan repayment. The governor's recommendation was $0 for this new decision item.
Thank you. Thanks. Again, do you have a sense of why the governor did not recommend that funding?
I do not. We didn't receive any feedback on the new decision items that were not funded.
So how does that affect, like, we have this new law, right? How will that affect potential applicants going forward?
Sure. So last year with the legislation, we did receive $970,000. So we are able to offer some loan repayment. We just anticipate, because of the dire need for healthcare workers and the fact that
Right.
it's an incentive to stay in Missouri if they receive the awards, that we will probably have more. I know we will have more applicants than we have award money available, and so this increase would allow us to expand to give more loan to our loan repayment awards to our healthcare professionals.
Okay.
Other questions? So, thank you. Proceed.
Page 484 is a new decision item related to expansion of our graduate medical education program. Again, last year we had legislation and some GR passed to start graduate medical education support in the state of Missouri. This governor's recommendation is for $3.5 million, and it is from general revenue. The importance of this is that we have medical students in Missouri who complete medical school, but there are not enough residency slots for them to continue on in their training to becoming a fully licensed physician, so they have to seek residency out of state. So by us being able to continue to build our program and help hospitals or other providers set up these residency slots so there are places for them to go, again, that's how we hope to help with our shortage of primary care and other important physicians in our state. We also know that graduate medical education is really complex, and that many states have set up technical assistance centers that help entities, figure out how to navigate lots of different funding that could potentially be available. What do you need to go about to get accredited, to establish these programs, or to increase these programs? And so part of this funding would also supply money to support a technical assistance center. All right.
Thank you. This quick question that comes to my mind now, I don't necessarily have to have the answer at this point, but I want somebody to show up. When you're from the rural part of the state, we have trouble getting people from my part of the world to be able to go and get accepted into medical schools, etc. Of course, somebody like me thinks for particular reasons, and that's unfair. What role does the department play, or do they play any role with the universities on deciding this is the checklist that a person must meet to be accepted in medical schools, or is that all determined, I'm going to say, within the college structure, AMA, whatever organizations, or does DHSS have any voice in that? And again, you don't have to answer that now, but I do want an answer.
Okay, yeah. And Dr. Miller would like to answer that here. And then I have a little follow-up of some things that our department can do to assist.
Senator Black, my name is Heidi Miller. I serve as the Chief Medical Officer for the Department of Health and Senior Services. We have worked so hard on workforce, and we have asked the exact same question that you have, Senator Black. We realize that our young physicians tend to stay where they train, and in particular, if they go to medical school in Missouri, and then they also complete their residency training in Missouri, there's an over 55% chance that they will stay in Missouri and pursue their career in our state. Currently, we're short about 1,000 physicians, so this is really worthwhile. Director Nicholson and I were actually speaking. We plan to meet with every medical school in this state to ask them exactly what is their quota for accepting Missouri students into medical schools, because we know if you're born in Missouri, you're raised in Missouri, you're going to stay in Missouri. And so we are going to be working on that this year.
Thank you. I'm sorry that I had to do this, but
No worries.
as you're going, but I guess not being from the healthcare profession, I look at the education stuff and the things that have been added over the years. Sometimes it's been because people like me getting elected and adding stuff. And what we've done is cut out people to go in a classroom. And I feel like there's been a little bit of that done probably in the healthcare field as well. So thank you for that, and follow up with me.
Yes, sir.
Mr. Chairman, you have the con? Do you have the con? Control? Yes. Okay.
Senator Esslinger.
I'm just curious about the number of new residency options that are going to be possible through this funding. Do we have an idea of the increase? How many more?
Yes. So this past year was the first time that Missouri invested in graduate medical education. Because the feds have capped their funding on existing programs, many states have resorted to funding this themselves. $2.3 million was granted to our department to try to implement a graduate medical education to expand current slots. That $2.3 million went to 9 slots. We had more applicants than we had slots, and we're delighted that 5 programs in the state of Missouri will be expanded, and it includes family medicine, internal medicine, and psychiatry. However, 9 new docs per year. We need 1,000 as of now, and even more as we project forward. So this current funding is designed to provide additional slots. But here's what we learned while we did a deep dive on graduate medical education this year. If we can start new programs in hospitals that don't have existing programs, they are eligible for sustainable federal funding forever after. So our rural areas need these residency training programs. An economic analysis done in Indiana showed that the return on an investment for every dollar spent on GME, you get $9 back. Communities flourish when they are training young physicians, and those young physicians are more likely to stay in practice in Missouri in a rural area if they have trained in a rural area. So this additional funding is designed to help hospitals and teaching health centers develop new programs. It's very hard to start a new program. The estimated cost is $750,000 to $1 million. But once that program is started, then we tap into the feds to pay their salary and the faculty salary thereafter. But setting that up is challenging, and that's why we need the Technical Assistance Center.
Senator Williams.
Thank you, Mr. Chair. I had one more question. I have the luxury of being familiar with Dr. Miller as a highly skilled physician in the St. Louis region. So I guess I'd love to ask you a question in regards to, and not to put you on the spot, but I think your training is relevant. How do you, in your mind, expand opportunities, as you stated before, to attract people to the profession, to want to practice in rural parts of the state that may not have grown up or even have a connection to rural Missouri?
We have learned statistically that folks who practice in rural areas grew up in rural areas. But as we have toured the entire state, and recently I had some very tender conversations with some dedicated OB-GYNs in the boot heel, and I asked them, what makes you committed to this work? Why did you come to it? Why do you stay? And the answer is either I'm from here, or Dr. Perez, an OB-GYN in Kennett, Missouri, is from Puerto Rico. And he said, I grew up in a small town in Puerto Rico, and I feel at home here. And he has served that community bravely and to great self-sacrifice for 30 years, but he's loved it.
Quick follow-up. The reason I ask that question is because it's going to be imperative that if we want to advance our state when it comes to health care, I think the pandemic exposed our country and the world of our shortcomings. I just did a breakfast this morning with leaders from the federally qualified health centers, and we're going to have to figure out how to train a new generation of physicians, in my opinion, that are culturally competent. And what I mean by that isn't just by race and gender, but understanding how various infections, diseases, and terminal diseases impact people because of their environment. So I'm hoping that our state puts something in place to provide an incentive for folks to go into that profession. And again, I was just a little bit biased by being familiar with their training in St. Louis, but I hope your leadership can provide us an opportunity to figure out a plan to move Missouri forward in that capacity.
Yes, sir. I can attest that the most promising practice in training primary care doctors who serve our most disenfranchised populations are occurring in teaching health centers. nationally. The Teaching Health Center graduate medical education model has, at this point, funding that's not as sustainable as hospital-based training. However, having had a primary care practice at a federally qualified health center for 21 years, I can attest the fact that everyone who works in that organization meets the mission of serving anyone, regardless of where they came from or what their challenges are, what their demographics are. And so that model is promising. Unfortunately, we do have some FQHCs across the state that are already teaching young physicians, and then we recruit from them, and they stay, and they like it, and they want to keep practicing in these underserved areas. Yeah, thank you.
Might as well just stay here in case we need it. Our next new decision item is also related to GME. It's on page 489. It's called behavioral health because the purpose of this is to draw down the opioid treatment and recovery funds to support GME residency slots for individuals who are trained to do substance use disorder treatment. So this would support residencies for internal medicine and psychiatrists. So the governor's recommendation here is for $4.5 million, and the other fund, the opioid treatment and recovery fund. All right, on to page 494 is our core for oral health services and initiatives. The governor's recommendation here is for a total of $3.8 million and 9.99 FTE. On page 508 is our core for our minority health initiatives. The governor's recommendation here is for a total of $491,703 and 4.73 FTE.
Mr. Chair,
Senator May.
I have a question. So can you tell me, on the minority health piece, where are they, what are the initiatives that are promoting, health equity and outcomes and doing the different partnership with communities across the state? Where is that happening now, and who is it happening with?
Sure. So this is our minority health office, and the main objectives that they have set out for this next year is focus on health literacy. So they are coordinating with all of our programs within the State Department of Health and all the literature and things that we put out to make sure that we are putting out literature that is something that can be understood by the populations it's meant to be made for. They are also still involved heavily in a lot of community engagement outreach events and looking at those to bring together community partners for areas of our state where we know we have a lot of health disparities. And so when we talk about community engagement, that could be, those focus for those could be rural, it could be in, rural, urban, it could be male, female, it could be African American, white, whatever the case may be, just addressing whatever is the, health disparity that needs to be looked at. They also doing a lot of focus.
Do you have any specific initiatives that are coming up across the state?
Yeah, sure.
And especially in communities of color?
Yes, we can provide you all the things that they have planned and even the things that they did last year.
Yeah, I will. Yes, please provide that for me.
And Dr. Miller wants to add something.
Yes.
Senator May, we infuse as many of our initiatives with an equity focus as possible. So it's not just one office within one division. Those leaders are invited into our maternal mortality work, our interactions with 115 local public health agencies. Their input is valued and informing multiple initiatives within the department.
Yes. So, I've been here, let me see, I think it's 14 years this year. And so the Department of Minority Health, I used to participate all across the state in the activities of the Department of Minority Health. And a lot of it focused around community engagement in reference to health. So we used to have all of these different health events that were educating, especially communities of color who have the lowest health outcomes of any other minority or cultural group. Because I hate to use the word minority because I think we need to separate African Americans from minorities now, because people who are claiming to be minorities are not really minorities when it comes to health outcomes and things of that nature. So I'm just trying to get a sense of where those things are so that the community can continue to participate in those events and, get that education, because the more you're in front of individuals, the more aware they become of, getting the, breast mammograms, getting, their shots, keeping up to date with all of that, that health information. So that's my concern. And since you missed, I must have missed, if we're talking about, I might have missed, I don't know if we got to it or not. I don't think we've gotten there yet. Have we gotten to women's health yet?
No, not yet.
Okay. Well, I'll ask another question when we get there. But if you can provide me with that information, I will greatly appreciate it, because I want to go ahead and
Yes,
get it disseminated like we used to. That's all. Thank you.
Sure.
Against his better judgment, the chairman has put me in charge, so please continue.
Okay, all right. Okay, so I think now we are on the core of for women's health and wellness, which is page 520. The governor's recommendation here is for 18.9 million and 23.96 FTE. If you go to page...
Senator May.
Yes. So we're here for the women's health. So my question on this one is, can you tell me, I know we started the Cora Faith Walker doula training program.
Mm-hmm.
Has that been implemented, and if so, where in the state has that been implemented?
So the money that we receive for that program has been implemented, and
Okay.
I don't know exactly, blanking on the entity that received that, but part of that funding is that they are developing curriculum for training more doulas.
Okay.
Okay, and then we've also had other funding in the budget given to us that has allowed us to fund some other specific doula services in other areas of the state. And doula is one of the things that the state, and Dr. Miller probably love to talk about this because she's heading up a committee for us to work across all agencies, our other partners on the maternal health issues. So we have a lot going on in there, but doula is something that we are trying to showcase the work and best practices to get that established in other parts of the state, and then also working with our partners such as Medicaid for their consideration of reimbursement of those services.
Yeah. And we don't have any midwives anymore, do we?
We do, and that's actually in this interagency statewide effort to improve maternal health across the state. We've come up with a focused dozen issues that need to be addressed, and one of them is to integrate more midwife care in the state of Missouri. We need more women's health providers. And just to add, in honor of Cora Faith Walker and the women who benefit so much from doula care, not only has we pursued the training, but we're working on standardization of definitions and training, because that will be the ticket to reimbursement, which I know our partners at MoHealthNet are working on.
Yeah. And so, listen, I ask these questions because, sitting here, I like to solve problems. And it seems to me that we're not always solving the problems because I keep seeing the same numbers. And let me give you an example. I used to sit on the prenatal infant mortality, whatever committee when I had to get off of it because it was so depressing and hurtful.
Yeah.
And let me give you some stats. Right now in Missouri, Black infants die at a rate of 11.3 per 1,000 deaths compared to 5.2 in other cultures. You get me? And so it's like I'm trying to figure out, how do we solve this problem? Where, how do we reduce this number of, infants dying? And I know I'm on a soapbox, but at the same time, I'm interested in getting it solved. And it seems like we keep we do things, we provide money to certain entities, but are we like having what we call administrative oversight over their metrics and, you know, their outcomes and things like that? I know it's hard for us to do as a state because, you know, most of them are private entities, but they have to be able to, we have to be able to leverage some kind of way for you to say, hey, you know, we're, you know, funding this with taxpayers' dollars. Tell us, what are your outcomes? What are your metrics? You know, how are you achieving the goals that, you know, the state has, you know, outlined, or, you know, something like that. So that's why I'm asking these questions, because I just, you know, want to actually see some movement.
So we share your concern exactly and compassionately, and it is traumatic to sit in a PAMR board review meeting in which individual pregnancies are evaluated in explicit detail to find out why a death occurred. What you witnessed was the Pregnancy Associated Mortality Review, the PAMR. And that has taught us so much about the women in our state, because the reasons why women are dying in our state are different than national numbers. And we need to know exactly what's affecting our population. But we have learned that doulas and community health workers and culturally congruent care save lives. And so there is movement in that direction. We're working on training, and we're working in close partnership with Missouri Health Net for reimbursement for those services, and also group therapy. Group prenatal care
Yes.
for pregnant moms. But what you're speaking about are really tragic infant mortality rates and the disparities within. And as Director Brennicke will speak to in a moment, our infant mortality rate across the state has increased 16%. And so in the proposed budget, in the governor's recommendation, is to start a FEMR, a fetal infant mortality review board, in the same way that we do for pregnant women, to figure out exactly what is happening to our babies.
Yes.
Why are our babies dying? We can look at national statistics and the top 10 reasons why babies die, but what's going on in Missouri, and then how do we target our interventions toward that? I defer to
Absolutely.
Director Brennicke to speak to that.
Thank you.
Senator May, I think there is a new decision item on 543 that speaks to that very issue, so thank you
Okay,
for
thank
raising
you.
it. Please proceed.
Sure. Okay, on page 538 is a new decision item, erase maternal mortality. ERASE is the acronym for the CDC grant that allows us to do the pregnancy-associated mortality reviews. We had the ability to draw down some additional funds from that grant to add informant reviews as part of our process. The department request was for federal appropriation of $80,252 and 1 FTE, and this is an item that the governor did not recommend.
On this issue, so we received the grant, correct?
Yes.
What happens if there is no FTE dedicated to it?
Well, if we don't receive the authority at all,
yeah.
we cannot spend that funding.
Okay,
Really?
thank you.
All right, and then onto page 543 is exactly what Dr. Miller so beautifully described. This is our new decision item for a state fetal and infant mortality review network. This governor's recommendation for GR in the amount of $1.8 million would allow us the ability to review all fetal deaths from 24 weeks gestation through 12 months after birth, and that we would have a statewide look, because right now we have a little bit of some groups in Kansas City and St. Louis trying to do that work. It would help us firm up and support that work, and then be able to support that review all over the rest of the state.
Absolutely.
And this review would follow an evidence-based model in which you would have a community review team of professionals that do the deep investigation as to what's happening, and then you have a community action team, which actually takes into their hands what as a community can we do to support or make changes so that we can avoid these deaths. All right, on page 549 is a new decision item for our SAFE-T network. SAFE-T stands for Sexual Assault Forensic Exams via Telehealth. This is a new program we were able to set up last year, and we're finishing implementation because of legislation and GR dollars that we received. to make sure that sexual assault exams can be done at every hospital in the state of Missouri. In that legislation, it also said that we need to go for any federal grants that could help support this work, and we know of an opportunity. So we would like to apply for and hope to receive a federal grant to help in this work. So the governor's recommendation here is for $615,341 in federal appropriation authority for that purpose. If we go on to page 555, we have a new decision item called Comprehensive Care of Pregnant and Postpartum. This is for governor's recommendation from other funds of a total of $4,354,576 and 2.5 FTE. The other funds would be from our opioid treatment and recovery funds. So 3 major initiatives that we like to do here, again, supporting women and trying to avoid our pregnancy, or trying to decrease our pregnancy-associated deaths. Our first initiative would be to kind of replicate a program that goes on in St. Louis right now. It's called WISH, for Women and Infant Substance Help. We'd like to replicate that program in Kansas City and in Springfield. What we see happening is that providers who are skilled in providing pregnancy care are not always comfortable in providing substance abuse treatment or substance use treatment to individuals who are pregnant. And substance use providers are not always comfortable in providing pregnancy care. So, we see that gap as being something that we'd like to address for other areas of the state that we see substance use being a key indicator for prevention of pregnancy-associated deaths. The second initiative just would help us to engage our rural providers more into the perinatal quality collaborative that we already have going on at the state. And 2 of those initiatives within that address care of the pregnant and postpartum woman with substance use disorder, and then addressing neonatal abstinence syndrome. And the third initiative from this funding would allow us to provide harm reduction kits to our obstetrician providers and to our emergency rooms. Last 5 years, over 27,000 women of childbearing age have come to our ERs for non-fatal overdoses. And so we would like to, at that point of entry, be able to supply them with a kit that includes overdose reversal supplies, information, linkages to resources, things that could help them to reduce the harm of their behaviors and hopefully keep them healthier in those times when pregnancy could become a possibility. All right. Our next core is vital records on page 562. That core decision item, governor's recommendation, is for a total of $3.2 million and 28.4 FTE. On page 575, a new decision item for vital records was for expanded operational costs. The department request in that line was for $271,999. The reason for this request from the department was that we've had several pieces of legislation that have made copies of birth and death certificates free to certain individuals. And as we have implemented that, then what we see is that the revenue that we would take in from those fees that come back to support our operations are then lacking to our operational support. And with the cost of supplies, the toner, printers, the paper, all those kinds of things, we were seeking general revenue to replace those costs. This is something that was not also recommended by the governor.
Can I ask on that, have you seen much demand so far? How many people have taken advantage of those changes?
Yeah, so actually our new decision item request was based on actual average numbers we've seen the last couple of years for the free certificates, and then just an estimation for the one that passed last year, because we're just still in that first year. If you'd like information about how much those actually are, we can get that to you.
That'd be great. And if you'll send it to Adam, then he'll get it
For
to
your whole
everyone on the
committee.
committee.
Yes.
Yep. Thanks.
Can do that. And then our last core for this division is on page 580, a core decision item for all of our COVID and ARPA initiatives. The governor's recommendation here is for a total of $513,915.50 FTE. What we did is in our new breakout and allocations, all of our grants received specifically for COVID response and ARPA initiatives were rolled into this one core. Previously, they were in our emergency preparedness core, so this just makes it very clear what are those specific things. And as time moves on, we'll continue to core cut, as we have several places in the budget book already, when we have grants that have ended, when we have, therefore, unexpended authority in this area. But I will take you to one last new decision item that's on page 596, and that is for a governor's recommendation of $5,534,126 in federal appropriation. This is due to a few of the grants we've already received from ARPA have had increases to the line for data modernization. And so our request is to be able to support those things as we continue to build our infrastructure with modernized data systems and data systems that speak to one another. And that is it for the DCPH budget. Thank you so much for allowing us to present your questions, and we'll get back to you all on the specific things that were asked.
Thank you.
Yes.
Any other questions?
Next up, we'll have someone from the State Public Health Laboratory. I think Adam Perkins.
Good morning. My name is Adam Perkins. I'm a deputy director at the Missouri State Public Health Laboratory. The laboratory has been in existence for over 100 years, and we now currently exist as a state-of-the-art biosafety level 3 laboratory just down the street here. I want to note that we are a leader in the state for implementing advanced technologies and methodologies to deal with emerging diseases, re-emerging diseases, and potential contaminants, including Ebola, rabies, drug-resistant bacteria, Legionella, tuberculosis, fentanyl, biological and chemical terrorism agents, along with more than 70 newborn screening disorders. Our testing services impact a diverse group of customers, including our local public health agencies, hospitals, veterinarians, law enforcement, and of course the citizens of Missouri, along with anyone who might visit our state. I do want to orient us now that we are on page 602 in the beginning of book 3. And here you will see our core budget recommendations from the governor. We do not have any new decision items to bring before you at this time, so I simply want to open it up to any questions that you may have about our core budget recommendations.
Thank you. Any questions?
I have one
Senator
question.
May.
So, don't we have a laboratory also in KC that
We have
deals with bio?
We do not. We do have a branch laboratory in Poplar Bluff that works with our breath alcohol program, but we do not have a Department of Health and Senior Services facility in Kansas City.
So it must be a private laboratory that deals with bio diseases and.
I believe that is correct.
Okay, very good. I remember visiting that. I was just trying to figure out if it was under the state. Okay, thank you.
Sure.
Any other questions? Thank you very much.
Thank you, and we appreciate your support for all of our budget considerations in the past. And I'm going to turn it over now to Melanie Highland in our Division of Senior and Disability Services.
Thank you, Adam. All right. As he said, Melanie Highland, Director of our Division of Senior and Disability Services. And I want to quickly draw your attention to a one-pager that I believe you have. It is on our Missouri Master Plan on Aging. One, to give you an update on where we are at with this initiative. It will run through calendar year 2025, so we are in our second year. And the things that I could use your help with is that we have draft recommendations from our advisory committee and the 7 subcommittees that we're planning on taking on the road now. So later on this month and throughout March, we have a series of in-person and virtual town halls, and you'll see that's on the back of your one-pager. And what we're wanting to do is get more input from our seniors and individuals with disabilities on our master plan on aging. So there are, each of our area agencies on aging, our AAAs, are hosting a town hall, and there's 2 virtual ones in March. And so if you wouldn't mind helping us spread the word to your constituents, again, the more robust feedback we get, the more inclusive and better plan that we have for Missourians to age healthy in the next 10 years. So quick plug for that. Thank you. I'll now turn your attention to page 614, which is our first core. This is our Senior and Disability Services Program operations. The governor is recommending 16.2 million GR, 21.8 million Fed, for a total of $31.8 million, including over 600 FTE. We employ these staff to work in the field across the state to do 4 key functions. Our Medicaid Home and Community-Based Services Program, our Section for Adult Protective Services, as well as our Bureau for Senior Programs, and our Long-Term Care Ombudsman Program. Turning to page 613 is our first NDI. This is the governor is recommending 752,000 GR, approximately equal amount of Fed, for a total of 1.5 million funds and 16 new FTE. As part of our master plan on aging, you know that our aging population is only growing. Despite increased program efficiencies and expanded partnerships, we still have an additional need for FTE to meet the annual reassessment needs of our 65,000 seniors and individuals with disabilities. Per state and federal requirements, every participant in this program is assessed face-to-face annually in their home. This body had previously funded new FTE at a rate that maximized our community partners and our VBP reassessment program. Thankfully, we were able to recruit community partners to conduct 25,000 more HCBS reassessments, but that still leaves us with another 20,000 reassessments to be completed. So our current plan is to, 1, hire an additional 16 staff to conduct those assessments in our most populous areas of the state, and to also increase our regular provider reassessment rate from $75 to $100 to increase the volume of our providers that are conducting those reassessments. This rate has not increased since 2015. And our hope is that these initiatives successfully meet the needs of our consumers, and we don't have to come back again next year asking for additional resources.
Madam Chair,
Senator May.
2 questions. So the in reference to what you just said, to reassess the seniors in their homes, and have that position been posted, or has it not? And
Well,
what areas are you looking for these 16 individuals to oversee?
Yes, well, we can't post the positions yet. We already have, we employ about 90 across the state of our senior specialists to do this work. These would predominantly be located in probably our Kansas City and St. Louis areas, as these have the most, we have more of our consumers that are served in there. Because they are doing home assessments, they need to go be located in areas where they can go do that home assessment.
And the other question is, because when we're out knocking on doors, yes, I see seniors, and when I go in there, sometimes, they invite you in, you can tell that they need help. Okay. And so can we refer those individuals, like, those seniors, and how do we do that referral process? I remember doing it one year, and they helped this one senior, move out of her house and move into a facility that she was cared for, and and all of that. But do we,
Absolutely. Yes, I will actually give you my business card, and in just a minute. On the back has our, sorry, I'm not speaking into the microphone.
You're fine.
On the back, you can call our 1-800 number and file for a referral for a new participant. You can also file that online and submit that online for new services, to initiate services, or to seek a change in services.
Absolutely. Thank you. And one last question, and I'll let us move on. The senior transportation, It used to be, I forgot who used to administer, how are we administering that program, for seniors, transportation, and I'm also concerned about food, because the seniors said that, I talk to my seniors all the time, and so, I'm interested in the quality
Absolutely.
of the food, the change in the quality of the food. I'll say that. It's been a change in the quality of food that they're getting. So who's handling that transportation and the quality of the food or whatever?
Yes, absolutely. So transportation, very hot button topic. One of the focus of our master plan on aging. There's a lot of different vendors in this transportation area. There's obviously Medicaid with their NEMT contract, the non-emergency medical transportation. But in addition, a lot of our AAAs do fund transportation. And I think a lot of it has been, some of the issues are because of a higher demand in drivers and not being able to meet that. So a lot of them are utilizing kind of Uber-style programs. And so that is an ongoing issue that we are trying to find better solutions about. So I don't have a great answer for you, but I know we have a lot of different partners as part of our subcommittee on Master Plan Aging. It's a transportation and mobility committee. And has some really great recommendations coming out of that. But I would go to the local AAA. If there's a specific issue you want to talk to me about afterwards, I'm happy to help you with that. As far as the quality of the food, again, that is our area agencies on aging that are responsible for procuring that contract for whether they're doing, I don't know if it's a home delivered meal or a congregate meal, but if there's a particular issue, please let us know. We work with our AAAs and we want to know about that to try to figure out what happened in that change and what is different.
Okay.
Okay.
Very good.
We'll
have a lot of conversations offline.
Great. We are coming up against a hard deadline. You have about 20 minutes to get through the rest of the book, and
Yep.
I'm turning over the controls to Senator Crawford.
All right. Thank you. Moving on to page 639 is our Senior and Disability Services Core for our non-Medicaid programs, 2.5 million GR for a total of 6.7 million funds. This funds 4 different programs. This is our APS short-term interventions for individuals who are referred through our hotline, as well as our adult brain injury program and our children and youth with special health care needs. It also does fund our NME CDS program, non-Medicaid eligible program. Moving on to page 673 is our next NDI. This is our Adult Protective Services interventions. This is $257,000 federal funds. This is for a new dedicated federal fund that will be ongoing to specifically for states to implement or reinforce their APS work. Moving on, page 679 is our next core. This is our Medicaid HCBS Consumer Directed Services Program. This is 238 million GR, a matching fed for a total of 736 total funds. 736 million total funds. This is half of our $1.5 billion program. And on the next page, page 685 is the other half of that. This is our in-home agency model, 231 million for a total of $731 million. And this is to support our activities of daily living to help seniors and individuals with disabilities to remain in their home. Moving on to page 691 is our HCBS Services Enhancements Core. This is $13.4 million of enhanced HCBS FMAP dollars to do some one-time interventions, mainly in our technology realm. Moving on to page 702 is our Senior Services Growth and Development Program transfer. This is the core for the $8 million that is going from GR to support our seniors in the AAAs. On page 707 is our a new decision item related to that transfer. The governor is recommending increasing that by about $1.2 million in anticipation of what that transfer would actually be in FY25. Page 710 10 is our Area Agencies on Aging Core. This is 12.9 million GR for a total of 70 million total funds. And this is to support our area agencies on aging, our AAAs, and all of the fine work that they do. Moving on to page 734 is our Older Americans Act Federal Fund Authority, NDI. This is $7.2 million of federal authority to spend their base block, their base grant that they need. This just ensures that we can pay the bills from the right spot whenever they seek reimbursement. Page 737 is our AAA home delivered meal production expansion NDI, $1.2 million of federal funds. This is part of the 15-1 that you all originally appropriated in 23. AAAs are planning to spend about 13.9 of that. Just need a little bit more time to spend this 1.2. So not new money, just more time to spend. Page 743 is our Senior Services Growth and Development Fund Authority. This is the spending authority for that transfer that you heard me talk about earlier, as well as $7.8 million of authority from the one-time arrearage that was transferred this year. Just gives them a little bit more time to spend that, not new funds. Page 746 is our Alzheimer's Services Core, 1.1 million GR. This is to support individuals with dementia and their caregivers to remain in their home. Page 755 is our Senior Independent Living Program. This is 400,000 GR, and this is to help support aging in place in 4 different communities across our state. Last is on page 764. This is our naturalization assistance, 200,000 GR, and this is to help frail senior immigrants and refugees to gain citizenship, so that way they can qualify for federally funded services. And with that, I will turn it over to Steve Boland with the Division of Regulation and Licensure.
I will try to talk as fast as she did. Good morning, members of the committee. My name is Steve Boland. I'm the Division Director for Regulation and Licensure. If you'll turn to page 773, you'll see the governor's recommendations for the allocation of $12.7 million in general revenue, $13.7 million for federal funding, and $7.3 million from other sources, total of $33.7 million with 380.53 FTEs. On page 791, there is a governor's recommendation for the allocation of $630,000 from general revenue. This is to operationalize the new supplemental health care services program that was passed when Senate Bill 10 was made into law back in 2022. This gives us the staffing to execute the program. We started accepting registrations from temporary staffing agencies for the state. They provide the personnel for hospitals and long-term care facilities. This will allow us to carry out the requirements of legislation. Next, please turn to page 798. On page 798, this is a department request, not necessarily a division request, but the bulk of this is within DRL. This is a department request for $2.4 million from general revenue, $1.1 million from federal funding, and $231,000 from other funding to support a proposed salary increase for RN surveyors. So we have RN surveyors and a whole host of other healthcare professionals within the department that provide a variety of services across the state. In the division's case, they do a lot of surveys at long-term care facilities and at hospitals. This is to allow us to become competitive with the market for nursing. We are about $30,000 behind the market in terms of average salaries for nurses. Next tab is on page 812. This is a governor's recommendation for allocation of $1.7 million for general revenue. We need to get a new database for our Bureau of Narcotics and Dangerous Drugs database. Every prescriptive authority practitioner in the state, they have to register with the state. Once they get registered, then they go to the DEA and get their actual prescriptive authority. That allows them to write prescriptions to patients. If our system crashes and it's 11 years old, we'll have to go back to paper. We do not want to go back to paper. So this is a very important request for us. Yes, ma'am. On page 817, this is the core request for the Time Critical Diagnosis Program. The TCD program is a voluntary program that hospitals are designated to provide advanced level care for stroke, STEMI, and trauma. This is the ongoing funding of $775,000 to support the 7 FTEs and do the work that they do with the facilities across the state. Page 825 is my last request. On page 825, there's a core summary for the QIPMO. It's the Quality Improvement Program for Missouri. This is an educational program that allows us to fund training, continuous quality improvement improvement activities for nurses and long-term care executives and nursing home directors so they can better what they do. One of the things they do is they improve resident assessment when they get the resident there for the first time, and that helps them to improve the care that they provide at the long-term care facilities. Total for recommendation from the governor is $325,000 in general revenue, $1.1 million in other funding, totaling $1.4 million to fund this program. I have nothing further to present, and we'll be happy to answer any questions.
Fantastic. Any questions from the committee? Does not appear so. Appreciate the testimony.
Thanks, sir. Next up is Amy Moore, Division of Cannabis Regulation. Amy.
Good morning.
Morning.
Amy Moore, the Director of the Division for Cannabis Regulation. I don't think I can talk as fast as my last two colleagues, but I will try. So as you know, legalization of cannabis use for medical purposes was passed in November of 2018. In November of 22, that law was amended to allow for adult use of cannabis. The Department of Health has organized a Division of Cannabis Regulation, of which I'm the director, to run both of those programs. So what I'm covering will go over the medical program, the adult use program, and the transfers to beneficiaries of these programs as well. So starting on page 834, core decision item you see here is for adult use cannabis. So that's operational expenses for running the adult use cannabis program. It's $14,151,086 with 134 FTE and a flexibility request of 10%. These are the positions that we have to administer the adult use program. Then on page 846, what you see here is $1,278,973 in core for grants to address substance use disorders. This is one of the beneficiaries of the program. Taxes and fees pay for our administrations of the program and then eventually flows to recipients who will get everything left over. One of them is a grant program run by DHSS for the purposes of substance use disorder prevention and education. Then next on page 850, this is an NDI for that grant program in an amount of $7,819,646. Page 853, we have our medical marijuana core. So this is the operational expenses of DHSS in running the medical marijuana program, which is still going. We still have about 107,000 patients in the medical marijuana program. The amount is $9,904,629 with 23.5 FTE and a flexibility request of 10%. Then on page 864, we have the adult use cannabis transfer core. So this is $3,836,919 in a core transfer from the adult use side of the program. So again, taxes and fees go to operational expenses of DHSS and eventually flow to beneficiaries. So this would cover the amounts for expungements. There are expungement activities that are required by Article 14. Veterans Health and Care, so the Missouri Veterans Commission does benefit from the adult use side as it did from the medical side, and also the public defender system. This amount is split evenly between those three efforts, so that's $1,278,973 each. Then on page 869, we have an NDI for that same transfer that would add $23,458,938. That since it's split between those three efforts, expungements, public defender system, Veterans Health and Care, each of those have an even split, and that's $7,819,646 each. And then finally on page 873, we have the transfer to the veterans from the medical side of the program. It is $13 million in core. That's the amount that, again, just like the adult use side, first we pay for operational expenses of the department. Everything that's left over goes to the Veterans Commission. Any questions for me?
Yes.
Yes.
Senator Crawford, real quick.
just real quickly, on the expungement money that you mentioned a couple items back, does that flow down to the counties to the circuit clerk's office, or where does that money go?
I actually don't know. So what I can say is this is the transfer amount that goes to expungement efforts, but it is judiciary that receives that money, as far as I know, and I am not familiar with what they do.
Okay, well, the circuit clerks, that's in that system, so maybe it flows on down to them. I'll check with them. Thank you.
Sure. Yeah.
Senator May.
Yes, so the money that this is the self-sustaining. Is that the money that's coming in and we're sustaining the department and the program based on what we're getting?
That's correct. All fees from the program and all the special taxes that were put on the retail sale of the program, that all goes into these funds and completely pays for operational expenses of the program. And then all of those millions that are left over goes to those beneficiaries.
Okay.
No general revenue.
Okay, very good. And I need to follow up on an issue we had, over the summer. You remember? Or?
I do, yes.
Okay. So can we follow up on that?
Absolutely.
Thank you.
Any other questions from the committee? Does not appear so. Thank you.
Thank you. I will
Legal expense fund, $1.
$1.
Good.
You stole my thunder.
Just trying to be efficient. Any other questions from the committee? Appreciate you guys being here today. If we do have any questions, we'll follow up with you. Thanks.
Perfect.
All
Thank
right.
you.
The hearing's adjourned.
Yeah.